If you are over 60 and you have noticed that your legs feel heavy, your feet tingle, or you get tired faster than you used to, I want you to pay close attention to the next 10 minutes, because what I am about to share with you could genuinely change the way you feel every single day. We are talking about blood flow, specifically circulation in your legs. And before you think this is too technical, stay with me, because the science here is actually fascinating, and the solution is far simpler than most doctors ever explain. Today, I am going to walk you through 3 clinically supported leg exercises, movements that have been studied in peer-reviewed research, tested in older adults just like you, and shown to meaningfully improve lower body circulation in as little as 10 minutes. These are not high-impact movements. You do not need a gym. You do not need equipment. What you need is a chair, 10 minutes, and the willingness to invest in your own health. Let us start with why this matters. And I promise, this will be one of the most important things you hear today. Here is what is actually happening inside your body as you age. And I want to be very precise about this because the research is clear. A widely cited body of vascular research, including studies published in the Journal of Physiology, confirms that peripheral blood flow, that is, circulation in your arms and legs, declines significantly between the ages of 20 and 70 due to several interconnected physiological changes. That decline has real daily consequences. There are 3 primary physiological reasons this happens. First, arterial stiffness. Research published in Hypertension, a journal of the American Heart Association, confirms that arteries lose elasticity with age due to changes in the structural protein collagen and a reduction in nitric oxide, the molecule that signals blood vessel walls to relax and widen. When vessels cannot dilate properly, blood has to work harder to move through them. Second, reduced muscle pump function. Your calf muscles act as a secondary heart. Every time they contract, they push blood upward through your veins back toward the heart. As muscle mass naturally declines with age, a condition called sarcopenia, this pumping action weakens significantly. Third, venous valve weakness. The small one-way valves inside your leg veins that prevent blood from pooling downward become less efficient over time. This is why many older adults experience swelling, varicose veins, and heaviness in the legs by the end of the day. Now, here is the powerful part. And this is where the research becomes genuinely hopeful. A systematic review published in Aging Research Reviews analyzed dozens of clinical trials and concluded that targeted lower limb exercise consistently and significantly improves peripheral circulation in adults over 60, even in those with existing cardiovascular conditions. The improvements were measurable in as few as 2 to 4 weeks of consistent practice. What this tells us is that your circulatory system is not fixed. It responds, it adapts, and it responds quite well to movement, specifically the right kind of movement. The 3 exercises I am about to show you were selected based on 3 criteria. They are supported by peer-reviewed clinical evidence. They are safe and appropriate for adults over 60 regardless of fitness level, and they can be performed in a seated or standing position without special equipment. Exercise 1. Ankle pumps, dorsiflexion, and plantar flexion. The first exercise is called an ankle pump, and it is one of the most clinically validated movements in rehabilitative and vascular medicine. Research published in the Journal of Vascular Surgery and Related Vascular Literature has shown that rhythmic ankle pumping exercises significantly increase venous blood flow velocity in the popliteal vein, that is the major vein behind the knee, within just minutes of activity. The increase in flow has been shown to be comparable to short bursts of walking. Studies in surgical and orthopedic rehabilitation settings have demonstrated that ankle pump exercises reduce the risk of deep vein thrombosis, dangerous blood clots, by improving venous return from the lower extremities. This is precisely why these movements are routinely prescribed after surgery and recommended during long-haul flights. The mechanism is straightforward. When you flex and extend your ankle, you activate the soleus and gastrocnemius muscles, your calf muscles, which compress the deep veins of the leg and propel blood upward toward the heart. This is the muscle pump mechanism described earlier, and ankle pumps are its most direct and targeted activation. How to perform ankle pumps correctly? Sit comfortably in a sturdy chair with your feet flat on the floor, or lie on your back if that is more comfortable for you. Slowly lift the front of both feet off the floor by pulling your toes up toward your shins. This position is called dorsiflexion. Hold for 2 seconds. Then slowly point both feet downward, pressing your toes toward the floor. This position is called plantar flexion. Hold for 2 seconds. That counts as 1 full repetition. Perform 20 repetitions. Rest for 30 seconds. Complete 2 to 3 sets. Clinical tip: perform ankle pumps at a slow, controlled pace, approximately 1 repetition every 3 seconds. This allows full engagement of the calf muscle and maximum displacement of venous blood with each cycle. Rushing the movement significantly reduces its circulatory effectiveness. As you perform this movement correctly, you may notice a warm or mild tingling sensation in your lower legs and feet. This is the increased blood flow reaching tissues that have been relatively underperfused. It is a positive sign. If you feel sharp pain, severe numbness, or intense cramping, stop and rest. Mild calf fatigue is completely normal and expected. For optimal results, perform this exercise 3 times per day, morning, midday, and evening. Research on venous return exercises consistently shows that frequency of short sessions outperforms single longer sessions for circulatory benefit in older adults. Exercise 2. Seated straight leg raises, quadriceps activation. The second exercise activates a different and equally important component of your circulatory system: your quadriceps, the large group of muscles at the front of your thigh. Your quadriceps are among the largest muscles in the human body. They contain an extensive network of capillaries, the tiny blood vessels responsible for oxygen and nutrient delivery to tissues. When large muscles contract regularly, they stimulate a process called angiogenesis, the formation of new capillary networks, and they significantly increase arterial blood flow to the entire lower limb. Clinical studies following adults aged 65 to 79 through programs of seated leg resistance exercises have found statistically significant increases in femoral artery blood flow, the main artery supplying the thigh. Participants in these studies also consistently reported reduced leg fatigue, improved balance, and better walking endurance over the program period. Research published in peer-reviewed exercise physiology journals has confirmed that even low-intensity leg raises performed while seated activate sufficient quadriceps recruitment to produce meaningful circulatory responses in older adults with limited mobility. This is why physical therapists and vascular specialists regularly prescribe seated leg raises to patients managing peripheral artery disease, post-surgical rehabilitation, and the effects of prolonged bed rest. How to perform seated leg raises correctly? Sit upright in a sturdy chair with your back against the backrest. Keep both feet flat on the floor to start. Slowly straighten your right leg by lifting it until it is parallel to the floor, or as close to parallel as is comfortable. Flex your foot so your toes point toward the ceiling. Hold this position for 3 to 5 seconds. Actively squeeze the muscles at the front of your thigh throughout the hold. Slowly lower your leg back to the starting position. Do not drop it. The controlled descent is where a significant portion of the muscular and circulatory benefit occurs. Complete 10 to 15 repetitions on each leg. Rest 45 seconds between sets. Perform 2 sets per leg. Important form note: keep your spine tall and your core lightly engaged throughout this movement. Leaning back excessively or hiking your hip reduces quadriceps activation and shifts strain to your lower back. If you cannot fully straighten your knee, that is completely fine. Raise the leg as far as is comfortable and pain-free. As your strength and circulation improve over the first 2 to 3 weeks, you can add a small ankle weight, starting at half a pound to 1 pound, to increase the resistance. Research in exercise gerontology has found that progressive resistance in this modest range produces significantly greater gains in lower limb blood flow compared to non-weighted versions after 4 weeks in adults over 65. Always prioritize proper form over added weight. Exercise 3. Standing heel raises, calf raises. The third exercise is the most powerful of the 3 for improving active venous return, and it brings together everything we have discussed about the muscle pump mechanism into one highly effective movement. Standing heel raises, also called calf raises, have been studied extensively in the context of vascular health in older populations. The soleus muscle, which runs deep beneath the gastrocnemius in your calf, has sometimes been described in physiology literature as having a peripheral circulatory role, similar to a second pump. It has a uniquely high density of slow-twitch muscle fibers and an enormous capacity to push blood upward through the venous system against gravity. Research published in the International Journal of Environmental Research and Public Health has examined the effect of standing calf raises on lower limb circulation in older adults, finding that brief bouts of intermittent calf raises significantly increased femoral blood flow. This has important implications not only for circulation but also for blood glucose regulation, since poor circulation and metabolic function are closely linked in older adults, particularly those with or at risk for type 2 diabetes. A randomized controlled trial published in the American Journal of Physiology, Heart and Circulatory Physiology demonstrated that calf raise exercises performed regularly over an 8-week period produced measurable improvements in endothelial function, the ability of artery walls to expand and contract, in sedentary adults over age 60. Endothelial function is considered one of the most important markers of cardiovascular and long-term arterial health. The mechanism is this. As your heels lift and your calf muscles contract, they compress the soleal venous sinuses, large pools of venous blood that collect in the calf, and forcefully propel that blood upward through the popliteal and femoral veins toward your heart. This effect is strongest when the movement is slow and controlled, maximizing the compression time on the venous structures within the calf. How to perform heel raises correctly. Stand behind a sturdy chair and place both hands lightly on the backrest for balance. Do not grip tightly. Your arms are for balance support only, not for bearing weight. Stand with your feet hip-width apart and your weight evenly distributed between both feet. Slowly rise onto the balls of both feet, lifting your heels as high as is comfortable. Take a full 2 seconds to rise. Hold the top position for 2 seconds. Actively feel the contraction in both calf muscles. Slowly lower your heels back to the floor over 2 full seconds. Do not drop. The controlled lowering phase is critically important for both muscular engagement and circulatory effect. Complete 15 repetitions. Rest 45 seconds. Perform 2 to 3 sets. Safety note. If you experience calf cramping during this exercise, pause and gently stretch by stepping 1 foot back and pressing the heel firmly into the floor. If you have a diagnosed condition affecting your Achilles tendon, plantar fasciitis, or significant ankle instability, please consult your physical therapist for a modified version before proceeding. If standing feels unsafe or uncomfortable, a seated version of this movement still produces meaningful circulatory benefit. Simply sit in a chair with both feet flat on the floor, then rise onto the balls of your feet in the same slow, controlled manner. Research suggests the seated variation captures a substantial portion of the circulatory benefit of the standing version, making it highly appropriate for adults with balance concerns, lower limb weakness, or recent injury. Now that you understand each exercise individually, let me show you how to combine all 3 into a single 10-minute routine you can do every day, or at a minimum 3 to 4 times per week. Here is your complete 10-minute circulation routine. Step 1, ankle pumps. 20 repetitions, 2 sets, 30 seconds rest between sets. Approximate time, 3 minutes. Step 2, seated leg raises. 12 repetitions per leg, 2 sets per leg, 45 seconds rest between sets. Approximate time, 4 minutes. Step 3, heel raises. 15 repetitions, 2 sets, 45 seconds rest between sets. Approximate time, 3 minutes. Total active time, 10 minutes. No equipment required beyond a sturdy chair. Research guidance on frequency. Meta-analyses of lower limb exercise protocols in older adults consistently find that sessions performed 4 to 5 times per week produce the most consistent improvements in peripheral blood flow. Daily short sessions are superior to longer but infrequent ones. Consistency over several weeks is the key variable. The best time to perform this routine is within 30 minutes of waking, when circulation tends to be at its lowest following overnight inactivity, and again in the late afternoon if you have been seated for several hours. Both timing windows have clinical support in the exercise physiology literature. These 3 exercises form a strong, evidence-based foundation. To amplify their effect, here are 4 additional daily habits backed by clinical research. 1. Hydration. Adequate hydration is essential for circulatory efficiency. Blood plasma, which carries red blood cells through your vessels, is composed largely of water. Research published in clinical nutrition journals has shown that even mild dehydration measurably increases blood viscosity. In other words, it thickens the blood and makes it harder to move through your circulatory system. Adults over 60 are especially vulnerable because the thirst mechanism weakens with age. Aim for 6 to 8 cups of water per day, unless your physician has specifically restricted your fluid intake. 2. Graduated compression hosiery. Medical-grade, graduated compression stockings have robust clinical evidence behind them. The Cochrane database of systematic reviews has confirmed that compression hosiery with appropriate pressure levels significantly improves venous return and reduces lower limb edema in older adults. Put them on in the morning before your legs begin to swell, and remove them at the end of the day. Speak with your doctor about the appropriate pressure rating for your specific situation. 3. Leg elevation. Elevating your legs above the level of your heart for 15 to 20 minutes once or twice daily uses gravity to assist venous drainage back toward the heart. This is a well-established, clinically recommended technique for reducing dependent edema in older adults and is especially useful in the evening after prolonged periods of sitting or standing. 4. Walking. Even short walks of 5 to 10 minutes are powerful complements to the exercises you have just learned. Clinical research consistently shows that several short bouts of walking throughout the day produce comparable cardiovascular and circulatory benefits to a single longer walk. If mobility is limited, even brief indoor walks along a hallway are genuinely beneficial. Every step activates the muscle pump in your calf. Before I close today, I want to speak directly and clearly about warning signs that go beyond what exercise alone can address. Please contact your healthcare provider promptly if you experience any of the following: persistent, cramping pain in your calves that occurs while walking and disappears with rest. This pattern may indicate peripheral artery disease, which requires proper medical diagnosis and management. Sudden, significant swelling in one leg only. This can indicate a deep vein thrombosis, which is a medical emergency requiring immediate evaluation. Skin discoloration, non-healing sores, or ulcers on your lower legs or feet. These require prompt assessment by a wound care or vascular specialist. Persistent numbness, coldness, or skin color changes in the feet that do not improve with gentle movement or warmth. Chest tightness, shortness of breath, or dizziness during exercise. Stop immediately and seek medical attention. These exercises are appropriate for the vast majority of healthy older adults. However, they are not a substitute for medical care when clinical symptoms are present. Your physician and healthcare team are your most important partners in managing circulatory health. Here is what I want you to take away from today. Poor leg circulation after 60 is not inevitable. It is not something you simply have to accept. The research is clear. Targeted, consistent movement, even just 10 minutes a day, can meaningfully restore blood flow, reduce swelling, improve daily energy, and support your long-term cardiovascular health. Your legs carry you through your life. Today, you have learned exactly how to take care of them, with science, not guesswork. Your action step right now is simple. Before you close this video, do your first set of ankle pumps. 20 repetitions. That is it. Start there and build from this moment. If you found this video helpful, please share it with someone you care about, a friend, a spouse, a sibling. Because this information matters, and it does not reach people without your help. Leave a comment below and let me know which of these 3 exercises you are starting with today. I read every comment, and your questions and experiences shape every future video on this channel. If you are not yet subscribed to Senior Health Insights, please click the subscribe button and the notification bell. We publish new, research-based health content every week, designed with one goal: to give you accurate, actionable information that helps you live better. Thank you for being here. Your health is worth investing in, 10 minutes at a time. I will see you in the next one.